You're listening to the Beauty Beyond Bella podcast, powered by Formula Wellness.
I'm your host, Dr. Yvette Suarez, owner and medical director of Bella Excellence, a diamond-accredited anti-aging med spa in the Tampa Bay, Florida area. On this show, we explore the latest trends in health, beauty, and anti-aging medicine while celebrating the inspiring journeys and achievements of our guests.
Welcome. Today I have Danielle Carle with me. She's our nurse practitioner at Bella Excellence. We're so excited to have her here. And we're going to actually start the podcast and talking about how do you get into the aesthetic field? And we all know that you have to be really resourceful when you're coming in. So Danielle, talk to me.
Well, how I got started at Bella, I was a little stalkerish. During nursing school, everybody, said that, getting into aesthetics was not attainable. Everybody wants to do it. It's oversaturated. You would tell them you want to do aesthetics and they would just be like, yeah, yeah. And so at one point I just stopped telling people. I was like, I don't know, maybe primary care, maybe ortho. And I knew that aesthetics was what I wanted to do, but I just stopped telling people because it was getting shot down after shot down. So when I was looking for a job, I reached out to Dr. Suarez because it was my first time getting Botox, like several years past, and I just knew I wanted to work local.
Well, look, we never want to be discouraged. I think a lot of us discourage each other to go into this field. It's very difficult. It's time consuming, right? You have to learn so much. And in reality, there's really no fellowship programs out there, right? So you can learn every other specialty but this one. But I will say, one of the things that I loved about you, coming from an ER background, we want people that are persistent. We want people that are going to be go-getters. And I think, I don't remember if it was you started every week texting me and emailing me, and then it went to every month. And even though I said, no, make sure you get back to me, I think you followed up every single month for quite a while until I thought, and if she's this tenacious to come in, tenacious, then I'm going to at least interview you. And you did. And I tortured her for a little while to make sure that she was going to fit the mold. But we're so excited that you actually came aboard.
Yeah, I love it. I remember going to get my teeth cleaned and I was like, we're gonna talk after my appointment. And you were like, okay. And I called you and I was like, so we're meeting in like an hour. And you're like, no, we're not meeting. And I was like, oh, I thought we were. And you were like, okay. So I showed up to the office and then we just headed off.
That's funny. See, I don't even remember that, but that it goes to show you if you keep becoming persistent in this field, it really will work out. And as you know, there's a really large learning curve. I know that I put you through a lot of shadowing at first. I think it's really important for us not to just learn the motion of the technique, but to understand that bonding time with our patient and coming up with a strategy for our patient. What was harder? Was it the consultation part and understanding everything, or the actual mechanical part of injecting?
I think it was more understanding the mechanical part. I mean, that as well. I remember my first time doing Botox and I had shadowed you several months and I brought in a friend and I was injecting. I knew exactly where to go. And you were like, okay, go for it. And I was like, right here. And you're like, yes. And I'm like, no, look, like right here. And you're like, yes, just inject. So that part, I think just getting the confidence and then, I feel like seeing the patient and like seeing what they really need, that just comes. But yeah, just getting the confidence really.
I love that because people, when we train for these other companies too, they're so meticulous, right? They want to make sure you watch every single thing. Was I deep enough? Was I not? And I try to explain to them, in the beginning, it's very scary. You're very observant. You're very tracking every single unit. And after some time, even a year or so later that goes by, it becomes like just innate, right? I tell them you could almost push it and know how many units you're pushing without staring at the syringe.
Oh yeah.
And people don't believe me. They're like, that's because you've done it for 20 years. 20 years. Can you tell me that it's not as scary now? It's a very easy format.
Oh yeah, it's definitely not as scary now. I can do it so quickly. I have them make their expressions and you just remember their facial, movement, and you can really do neurotoxins very quickly once you've done it, just for a year or so.
Yeah, I agree. And just like everyone else, we start in different areas. I think I start normally educating on label, right? The 3 areas: off label, lower face, neck, underarms. What has been your favorite, or is it a combination for toxin fillers?
Ew. I definitely think fillers, I think, would be more of my favorite because it's like initial instant gratification. You can really see the results right away. Whereas neurotoxins, you wait, that 2 weeks really to see your results. Um, but I like doing mid face definitely because people come in all the time and they're like, I just look so tired. They're like, every patient comes in and they're like, I want to look like this. They all lift up their face, but they all think that they need this area or under eyes. But once you really correct that mid face, it really makes such a difference. And I just had a patient this week that said, thank you so much for, doing that because I would have never thought to do mid face. I would have just thought, oh, let's do right here. And I think that's where our education comes in.
Oh, absolutely. And you missed the time frame 20 years ago where we were just giving everyone monkey looks, right? That was the big thing, to just treat nasolabial folds and around the mouth line and not really reposition to a more healthy, updated look, right? The tear troughs, the temples, the cheeks, and those are all really giving our patients a much more natural look. So now we have lots of devices. You got trained on all of them.
Oh, yeah.
So you are our cool sculpting queen, our laser queen, Ultherapy, plasma devices. But I think that's really important to have a multitude of things that you can actually make a change in your patient's face. So tell me a little bit how you go through those.
Oh, yeah. So there's a lot of things that we can correct with injectables, but that's not the holy grail. We need, multiple services to really see the full result. And not just products, I mean, not just devices. We really need the products. A lot of people, come in and they're super, want to do all these procedures. And it's like, well, what are you doing at home? And they're like, well, I'm using bar soap. And it's like, okay, well, let's start with products first and really get a baseline because we can do all the procedures here in office, but if you're not doing the work at home, you're really not going to see the results that you want to see. But once we really get established with products and, Botox, fillers, I really like the Ultherapy for the lower face because it really helps lift and tighten, and it's going to change the way that the patients age. And they don't see the results right away, but over the next 3 months, they're like, oh my gosh, I love it.
I agree. I always talk about that's my only thing that's going to save me from getting a facelift anytime soon, right?
Definitely.
It's that, like you said, you're not seeing the results for 3 to 6 months, but if we can do something on a yearly basis that's going to really kind of reverse our aging and prevent us from aging, I'm all in on Ultherapy.
Oh, yeah. And then for body, I would definitely say CoolTone is like my little go-to right now. It really helps tighten the core. You can do it on your legs or your booty. But it really makes such a little difference, gives you a little step forward in the gym.
And we have no shame at the office, as we know. We all running around there trying to do our procedures. I loved CoolTone on my butt. I love the lift it gives. And this one goes and shows everyone my photos, and which is totally fine because we really can't, as women, be shameful in trying to look better and do things for ourselves. I think in this society, people are still really shy, even about getting Botox. So you're still getting that?
Oh, yeah. So many patients are like, I don't want anybody to know. And they're like, you don't have anything, do you? And I'm like, oh, yeah, like a little bit everywhere. And they're like, okay, I want to look like how your natural results look. And I'm like, okay, we can do that.
Yeah. I like to think that Bella has a much more natural approach for our patients. I think they all look stunningly beautiful and young and not overdone, which is a big stereotype that people are worried about when they come in.
Oh, for sure. I see a lot of these girls, especially on social media, that their lips are like overtaking their face. And I feel like a few years back, that was bigger trend, and it's kind of been scaled back a little bit, which I like. And now we're doing some dissolving and then refilling, really trying to get the natural results.
We're also switching, even though we're very predominantly a heavy filler company, right? We love our fillers and we can make our fillers look super natural and conform for a good jawline and structure for the face. But now a lot of people are switching more to PRP gels, Sculptra, things that are going to build long-term collagen.
Oh, yeah. I recommend that, I think, every single day. When a lot of our patients don't really need the filling anymore and they just want to maintain the natural results, or they're like more holistic and they're like, what can I do that's, not injecting, something that's not theirs. So really, pulling their blood and being able to inject their own PRP, I feel like that feels a lot more comfortable for them. And, it really makes a huge difference, especially with Sculptra.
Yeah, and they do. They get this beautiful glowing and they look better as they go around, right? So most times I think what fillers, and the reason why I like combining it also, the fillers, you see an amazing improvement initially. By 6 months or a year, it's going down. You piggy that with Sculptra, right? You see nothing now. And as that filler starts to go away, that Sculptra kicks in, and they never really have a downtime.
Right, and with the sculpture too, you can inject it in places that you really can't with filler, and it really just gives that like nice youthful plump back without feeling like their face is changing.
The Formula Wellness 4 cornerstones are nutrition, functional wellness, aesthetics, and brain health. These serve as a guide rail for individuals that are pursuing longevity inside and out. Formula Wellness is setting the new benchmark in preventative healthcare and aesthetics. Thank you for all of your support. To learn more, please visit www.formulawellness.com.
So once we got through all of these beautiful aesthetics, you know, my heart lays now with the wellness side and making sure that we feel amazing inside and out. And so you've taken on this role with me and really have helped us continuously grow this market of making sure that people understand all of that. Like you were talking about skincare, we talk about vitamins. Tell us about your transition into the wellness side.
Oh yeah, I love wellness. So a lot of our patients sit in our chair and we talk about, all the things that they can do to their face and their body on the outside, but they're talking about their anxiety. They're talking about how tired they are. They can't keep up, things like that. And we're like, do you know about hormones? Like, have you thought about hormones? Or a lot of patients too, for weight loss, they're like, I just can't lose weight. And, they're like, I've done everything that I possibly can. And we're like, well, have you checked your labs? And they're like, no. And, my primary says everything's fine. And I'm like, well, there has to be something underlying. So then we start dabbling into that, and it really just opens up like a whole new topic.
Yeah, so talk about the labs thing. That's my pet peeve. Everyone comes in and says they have normal labs and they could have a vitamin D of 30. Talk to me about what those ranges mean for us when we're looking at.
Oh, yeah. So on lab values, all lab values really range, with different companies. And most of them say they're normal, but everybody's normal is different. And a lot of these lab values are on the lower end of the bell curve. And we really don't think that's normal. We really want to optimize these patients and put them on the, 80% to 100 of the bell curve. And that's really when people start to feel better.
I agree. They literally will say it's okay to be at 10 percentile. So remember, when they do these labs, they're testing the entire population. And so it's really curved that the older you get, they are okay with your labs going down. And we know that optimization is what's going to give us the best, not only feel good, but to me, it's about longevity of life. I think people have forgotten that.
Oh, yeah, absolutely. Or I have patients that come in that have just seen their OB or their primary, and they're like, that's just a part of aging. They're like, you're 50, you're about to be in menopause. You should feel like that. And we don't believe in that. We don't believe that you should, just because you're aging, you should feel terrible.
I agree. And in transitioning between that aesthetics and wellness world, I think understanding when someone comes in and they are in menopause or perimenopausal, when you start losing your hormones, so if you lose estrogen, obviously we get some skin sagging and fine lines, wrinkles, low testosterone, gives you cellulite, decreased fatigue. And it's interesting that it can start off as an aesthetic complaint, but once we fix that, right, it's the wellness complaints that really make them impactful.
Oh, yeah, absolutely. You can look beautiful on the outside, but if you feel terrible on the inside, there's no point. Like, what's the point of, spending all this time and, just looking beautiful on the outside when really you're struggling with every single thing on the inside?
Yeah. Do you feel it's so rewarding when, especially a patient that gets a pellet for the very first time, right? They come in, they're exhausted, they're emotional, they're crying, they feel disheartened, right? They're very depressed. And then 4 weeks later, tell me what happens once they get that nice peak of their pellet.
Oh, yeah. I have a few patients that we see the husband and wife, and they feel great. And I have a little story, whereas one of the women came in and she's feeling great, and their cost needs to start being reduced, and I think she lost her job or took a pay cut, and so they're trying to find ways to cut costs, and her husband's like, there's one spot we're not going to cut, and we are not going to cut your hormones because it made such a difference, and her life and their marriage overall.
Yeah, we always talk about how sometimes a little sprinkle of testosterone saves marriages and saves our mind.
Oh, yeah, if we could sprinkle it everywhere, it would be great.
Everywhere, anytime. I think that they really do very, very well.
Absolutely.
And I love that you said husband and wife. Typically in this field, right, the women come in first. We have to make them feel better. And then shortly, the men start to come in because they realize, right? I think it's that 3 p.m. getting home from work. They're pretty still sharp. They're working hard, but they get home at 3 p.m. and they're couch potatoes. They're exhausted from their day.
Oh, yeah. And it's funny too because we have the women and they'll start asking little questions about like men's symptoms and they're like, is this normal? Like, what about this? And then like, 2 weeks later, they're like, do you think I can make my husband or my boyfriend an appointment? And we're like, absolutely. And a lot of our patients, they're lawyers, they're doctors. We have all different types, waste management, but it doesn't matter like, how old they are. They still have to produce at their jobs, at home. A lot of people are having kids later, so they have to keep up with little ones too.
Uh, I agree. And talking about little ones, I have found recently, and you probably are seeing the same thing, is that we're getting younger and younger. We're getting women in their 30s right now that have limited hormones, whether it's from having children or stress. But we're really seeing, particularly testosterone, very low levels at a young age.
Oh, yeah, for sure. Even myself, I kept coming in after work and I'm like, man, I am so tired. My hair's falling out and I had all these crazy symptoms. And I'm like, what do you think it is? Like, and my doctor would just say, my primary would just say, well, you just had a baby. You have young children. Of course you're tired. And I'm like, I don't know. Like, this just doesn't feel right. And sure enough, we tested my labs and no testosterone, like none at all. And, just now supplementing with a little testosterone, I feel so much better.
Yeah, I agree. I think there's between a good thyroid function test and a good vitamin D and testosterone. I think when we start to fix those 3 modalities, we make an enormous impact in the young population.
Oh, yeah, absolutely. And a lot of people think that testosterone is only for men, and it's for women too. Before I really even dabbled into wellness, in, nurse practitioner school, we don't really, go over that too much, dabbling into wellness. And now learning all the things I know is testosterone makes a huge difference.
Huge difference. And unfortunately, even in med school, it's okay to go through menopause. It's okay to get older. It's okay not to get replaced. I think everyone knows my biggest pet peeve is for a menopausal woman to go and see her PCP and talk about feeling depressed and can't sleep and being anxious and just not loving life. And the first thing they do is hand them a benzodiazepine prescription and an antidepressant.
Oh, yeah, I think that's happened to us all, which is crazy. And another thing that's not really, talked about is the importance of nutrition and exercise and, all the things together really make everybody feel better. But we kind of just put a Band-Aid on everything and we're like, here's a pill for this, here's a pill for that. And it's like, once we really start getting your hormones under control and getting your anxiety under control, we can start pulling back on all those medications. A lot of our patients will come in and we'll ask them what medications they're on, and the list is like 15, drugs long, and it's just overwhelming.
Yeah, and a lot of the young people, you can reboot them, right? They don't have to be on these medications forever. It's really getting them to be rebalanced, right?
Yes.
Getting off of birth control, rebalancing their hormones, and making sure that longevity-wise, they're going to be doing well.
Right. We don't just need to give them a prescription for this and then give them another prescription for a side effect of that medication and then another one and really start pulling back and, just giving them what's needed.
The other thing I think that was a little bit of a stigma, and the whole world seems to be on a GLP-1. And, I've always been really cautious about weight loss medications and making sure I think we do a very good job and keeping people on a very low, safe dose to make sure. And we're seeing now studies of improved cardiac health on these patients. But like you said, it's a combination. It's not just a drug, it's nutrition, it's counseling, it's a combination that I think we try to really impose onto our patients.
Oh, yeah, we have many successful stories with a lot of patients. A lot of times when we can get some of that weight off, we can get them off the blood pressure medicine, we can get them off the cholesterol medicine, and it's really made a huge difference. And with the GLP-1s, there is a stigma, but people have been on these for years and years. And, a few years back, everybody was on other medications that were for weight loss that are stimulants that were way worse for them. And we see that a lot of the GLP-1s are actually more beneficial than harmful in many cases.
Yeah, I agree. I think we've done a really good job of keeping people on those low dose and keeping it on maintenance. It is so rewarding, like you said, when they come in and they've lost 40 pounds, 60 pounds, it changes their entire life.
Oh, it does. Just their confidence is insane. And a lot of our parents that have littles are coming in and they're like, I can run around with my kids. I can sit down in the grass with them and get back up without struggling.
Yeah, and you don't even think about the day-to-day exhaustion, being out of breath, right? But imagine now impacting that they have lower cholesterol, lower hypertension, lower heart risk disease. They're improving their time on this planet with their family in a good, healthy way.
Oh, yeah. It makes a huge difference. Really does.
So one of the things that we talk about a lot with our boss ladies, and I like to think that we have all these amazing entrepreneur women, is the struggle it really takes to be an entrepreneur, a mom, a spouse, a daughter, trying to do it all.
Mm-hmm.
You came in and literally, I think within 6 months got pregnant right after you learned everything and had to go have your babies, which she's adorable. Tell me about what that like, and were you fearful, right? In this world, do you get fearful that someone's going to fire you, or how does that work?
Absolutely. I feel like there's never a right time to have children, especially as a woman. You don't want to have children in school. You don't want to have it when you just start a career. There's all these dilemmas. And I feel like if you just keep waiting, there's never a right time. I remember getting pregnant and we were trying for the baby. And I knew I was pregnant and I'm like, oh my gosh, I'm going to wait and just make sure everything's okay before I tell my boss. And, word got around and she's like, are you pregnant? And I'm like, yeah, but I was so nervous to tell you because I'm like, I just started this job. I don't want it to hinder my career. I love it here, but there's never a right time.
Yeah, I agree. And look, as women, particularly as a woman boss, you have to uplift other women. We should never be punished because we want to have children, right? We all want the best of both worlds. And
oh, yeah.
And that's really important for everyone to kind of help each other out through those times. And we've all had to do it. I remember I was an ER doc when I was pregnant with my son, and I just kept remember going up and down and going, oh, my water's going to break on this last moment and I'm going to have to leave. And now this baby, what's going to happen to my patients, right? Like, right. We worry about the craziest things. I remember afterwards breastfeeding, right? We both breastfed for quite a long time. And imagine trying to see patients in the ER. The boys thought they were really funny. They actually put a sign in one of the rooms, milking in progress.
Oh my gosh.
Like I was a cow. I was like, that is so rude. But that's okay.
Yeah, thank goodness now that they have all these little portable pumps and really for the working moms. I saw a meme the other day on social media that was like, here's to us women chasing careers and chasing littles. And I was like, that's so true. That is so true. But really, I mean, we can't do it without support. Like my husband's super helpful. We have hired help for the kids. And I never thought I would be that mom that was like a working mom because my mom's a stay-at-home mom. But really, coming to work is my break. And then that really lets me enjoy the kids when I get home versus being with them all day. And I'm like, oh my gosh, when is my husband getting home? Now I'm like racing home to them.
Yeah, that's a really good point. I think we feel guilty in one part by being away, right? And not being a stay-at-home mom. And at the same token, it really gives us some sanity, right? We need that adult conversation and that intellectual stimulation that sometimes you might not get at home.
Oh yeah, coming to work is definitely my break. Yeah, for sure.
She definitely does. And you literally glow when you come in. You're like, woohoo, I'm going to have some fun today.
I know. I tell all my patients, they're like, you're not like with your littles. I'm like, no, like this is my dream job. I love being here.
Oh.
Yeah.
So I think if we wanted to encourage other women to make sure that they can do it all and not to have, because I went through, I think my biggest thing, and I still wouldn't change much, but I felt a lot of guilt working all the time. And I always tell my children, I have 3 kids, 2 of my biological children, and then Bella was my 3rd baby, but Bella took most of my time. And however, it provided a lifestyle for my children. I was a single parent. I needed to make sure that I could do everything I can. But I think we need to give ourselves grace and not feel that guilt.
Oh yeah. My dad always said like nothing worth having comes easy. And I think it's important too to find a career or a job or the workplace that really works together with you. There are some like non-negotiables, like, mother-son dance. I am not missing. My work never gives me a hard time. I tell them like, this is something I have to do. There's a lot of things, I don't get to go to. I don't volunteer in the lunchroom and things like that. But the big important things I'm there for. And I feel like that's the important thing.
I agree. I think if we get, look, I didn't make every soccer game, right? But I've made all my home soccer games, right? So I think that little bit, and my kids never gave me grief about it. They know that they're unconditionally loved. And I think that we just need to keep doing a little bit of everything
Right.
to be successful and happy. And like you said, it's being happy in both parts of our world.
Right. And, having a career like this, makes me happy. And then we get to do the fun things, when I'm not working. So, it works out.
No, so I love that. So you know that we have our last question.
Mhm.
And sometimes it could be a really hard question. It seems like such an easy question, but yet a lot of people struggle answering that. And so I'm going to ask you, what does beauty mean to you?
Ew. Beauty to me means wholesome. You can't just be the most beautiful woman in the room if you're not beautiful inside and you are negative all the time, or you're just not a nice person. I feel like you can be so pretty, but you're not pretty if you're not nice to people. I feel like, respecting people, being nice to people, giving everybody the benefit of the doubt. Everybody's struggling with things on the inside, but really just giving that, gracefulness to people goes a long way.
No, I love that. We got to give grace. We got to get grace back. And I think in reality, people who are miserable inside actually need just a little bit more love for themselves, right? Maybe we give them a big hug and they were going to be a little bit brighter, a little bit softer.
Right. I totally agree. Yeah. Just being nice, really, really goes the distance.
So be nice with a little bit of grace. Thank you.